Hello and welcome to another episode of Coffee Talk with Encore. Today we're going to be discussing the topic of health equity and health literacy. And we're hoping the information that we share today gets everyone thinking about the impact that each of us can make on providing equal care to all, as well as striving to ensure that therapy education and the training that we provide our patients is truly being understood by each of our patients, and that's whether we're giving it to them in a verbal or a written format. Let's get things started by talking exactly about what health equity and health literacy are all about.
Yeah, definitely. I think it's just to kind of start off, just kind of talking about the definitions of each of those terms, because we hear a lot of these terms coming just from, our changing culture these days. So health equity, when we think about this term, we really need to make sure that we're keeping in mind that this is a person's ability to attain the highest level of health for all people, no matter their race, ethnicity, sexual orientation, disability. And then health literacy is the degree which we as people have the capacity to learn, obtain that information, process it, and understand it. So just kind of think of, a prescription. I remember learning this when I was in school. A physician may write a prescription and it shows up on the pill label, but then when that person gets it home, they don't understand the doctor's prescription on how they're supposed to take it, when they're supposed to take it, and even what the dosage is. So I think it's really important to make sure that our patients are understanding what we're saying, even as clinicians. Even if we think that, we're describing it to them really well, we need to kind of keep in mind some of those things, those disparities that really affect our patients' equity and literacy. So when preparing other presentations, I've come across a lot of this information. So just even looking at pockets of their geographical region, how their economic status is, if they are kind of scrapping by paycheck to paycheck, if they have access to food. There's a lot of research on food access, and I think that's really, really interesting and how it affects, multiple aspects of people's lives. Our education systems, of course, geographic region and their access to good health care. So if they're out in, a really rural region and they have to drive 2 hours to see a specialist, that really impacts people's health equity. And just even the neighborhood and the environment that they're living in and they're raised in. Of course, any social characteristics in the community. And then kind of going back to that food thing. So just their access to food. So there's an interesting statistic that research shows that at least 88% of US adults don't have adequate health literacy. So like I said before in that prescription example, how many of our patients are we handing a home exercise program to, or a list of strategies to do, or, safety constraints that we would like them to adhere to, and how much of that are they actually absorbing and understanding?
So I find it interesting when we work in the skilled nursing facility, we talk about being the most regulated industry in the world, right? There's more regulation for a skilled nursing facility than there is for a nuclear power plant. But we have to go back to why is that? And it's really interesting to look at the history of the minimum data set and to look at the fact that nursing homes in our country started in the 40s and 50s. And the government tried to develop a system to help guide patient care in those nursing homes because there just wasn't a precedent for how they were going to run. And today we see each year we have changes in that minimum data set and in the way that that information is handled. And this year is no different. We're seeing a bunch of changes come through, but a lot of those changes are looking at health. And so there's two different pieces to it. One is the government's trying to get the data to ensure that the programs are working. And so we're seeing us change the way we ask for the questions to make sure that they have access at that federal level to the right data so they can check to make sure that we're getting what we need for our patients. And the other piece is that they're changing the way that we ask those questions so that we can provide the best care. Our prescribers need to know our patient's ethnicity. And as we all know, you can't just look at someone and guess that. So they have to have that information so that they can read those lab values and look at the most likely medical diagnosis based on that lab value, ethnicity, race, gender. They have to have all those pieces in order to make those medical decisions. And then looking at language interpretation needs and health literacy to make sure that we are communicating that appropriately. So we're seeing that regulatory change come through, but know that it's not just because they want us to do more work. It's because they really are still trying to help us guide care.
Now, along with all of those changes and all of the changes that we're seeing with the MDS, there are changes that we can make on a therapy level too, in order to help increase that that health equity and making sure that people are having a good, solid understanding of what we're discussing with them. One thing that we can do is speak in more universally understood terms instead of using that strong medical terminology in our discussions. What we have to realize is that sometimes our patients don't feel comfortable asking if they don't understand. So, like Ashley was saying, if they get that medication bottle home and they don't quite understand how to take that medicine, they may not feel comfortable going to ask, and they may just kind of have that lost feeling the whole time. We can also use visual cues and illustrations in the handouts and information that we're providing to our patients in order to increase their comprehension, and maybe also assist if there is a slight language barrier between yourself and the patient. Just having some diagrams may be helpful. Quite possibly the most important thing that we can do to make sure that our patients have a good, solid understanding of what we're teaching them is asking them to show us return demonstration. So after we're educating or providing some sort of training to maybe it's the patient, maybe it's a family member, asking them to show us what we taught them so that we can make sure that they really truly did understand. And if there's still a little bit of hiccups there, we're able to fix it. We're able to see where those little road bumps are, and we're able to kind of, help our patients make sure that we have a good understanding. Because if we're educating them and training them and teaching them, and they're not having a good understanding of what's been taught, they're not getting their full benefit out of their therapy session.
And, as you're, sharing that information, Kelly, it's kind of putting into my mind, even just a recent appointment that I had where, they were describing like an ankle brace and boot for me. And they were actually talking about inversion and eversion and plantar flexion. And I'm just thinking, okay, they don't know that I work in the healthcare environment. I knew what he was saying. But on the other hand, if it was my mom, for instance, she would have probably just sat there and nodded. And then later gone, I don't know exactly what they just told me, but here it is. Here's my ankle brace, and I'll just try and figure out how to put it on. So, it is really important that we're communicating with people at a level, and not to assume that someone is, less educated or unintelligent, but really at a level of like, it's going to be meaningful to them, the information that we're providing them for sure. It is really important that everyone realize that, both health equity and health literacy are very important topics. We need to make sure that therapy clinicians are being mindful as they're engaging with both their patients as well as the patient caregivers. So we want to make sure that when we're providing our therapy services, that we're providing equality for all, that we're providing equal care, that we're providing equal communication in our education strategies that we're providing, and that individuals are understanding what it is that we're sharing with them so that those that are receiving that information, what we're sharing with them is going to be impactful. At the end of the day, we want to help them meet their goals and have a really positive therapy experience. So thank you for everyone for joining us today. We hope you've enjoyed listening in our discussion on the topic of health equity and literacy. And we look forward to having you tune in again for our next episode of Coffee Talk with Encore.